Welcome to the Health Deli, your local stop for a fresh take on community health topics. Come on in, grab a number, and let the guys behind the counter, Mark, Ben, and Mike, tell you about today's specials.
Well, hello. I'm your host today, Mark Young. And today we have something special for the listeners. We have two new hosts. So the Health Deli is expanding. We bought the shop next door, and we need more people. So we're gonna try out some new people in the Health Deli, try some employees. So this is like a working interview process. So to my left, I have Dr. Michelle Kelly. How are you today?
I'm great. How are you, Mark?
I'm great. Thanks for asking. It's kind of nice to not have Mike and Ben here. Well, not so much Ben, but Mike especially, because he's always like tearing me down.
Yeah.
So
we're here to
speaking of
build you
people
up.
who are going to tear me down, on my right, I have Dr. Katie Exford. How are you?
I am well. It's good to be back.
Yes. Both former guests. Never mind, Michelle Shea. I thought you were on the Health Deli once.
First time.
Wow. Welcome.
A true trial run.
Yeah, I should listen to the episodes maybe after we do them. But
I should have too.
yeah. And also, as always, a staple on the Health Deli, Andrew Tingley.
Mm-hmm. Somebody's got to record it.
Somebody's got to do the actual work. So, and I must throw a shout out to the Ferris State University digital media department for providing the beautiful Health Deli studios here in Big Rapids, Michigan. So we have our great studio and our great production team helping us out. So today's episode, we're going to jump right into it, is timely because of the Olympics going on. Have you guys been watching the Olympics?
I have. I'm a gymnastics girl. I'm not a gymnast, but I've been watching a lot of gymnastics.
Nice. Mm-hmm. Nice. How about you?
We were getting really into swimming.
Swimming?
Yeah, we watched a lot of swimming on Saturday.
Really?
Had a USA chant going.
Really?
Yeah.
Nice. You know, I haven't watched much. I watched one basketball game, and that's it. But this weekend, I'm going to get into it a little more. So today's topic is performance enhancing drugs. So kind of a little bit about the heavy hitters. It's kind of a laundry list of all of those different, I'm going to say all of them, kind of the most common agents that the athletes are using, and then why they're bad. So I know that when we talk about performance enhancing drugs, it's always in a negative connotation, and it should be. But usually the reasoning behind the negative connotation is not necessarily the fact that they're bad for the person. It's the fact that they're not, ethical. They're not legal. They got busted
cheating, right?
For cheating, right? Yeah. But we don't really, I think a lot of the general public doesn't really associate them with all of the negative health consequences. So even if you're not a competitive athlete, there are people who are using these drugs, and they need to understand that they're not safe. They really aren't. That's the takeaway message. If you're just getting out of your car and going to work and you don't want to listen to the rest of the podcast.
I was going to say episode over.
Well, but we need to understand why also that these are not safe substances. So I'm going to jump into it. Again, kind of a laundry list, but one of the first, probably the heavy hitter, the one that everyone thinks of, is anabolic steroids. And anabolic steroids, anabolic means to build mass, basically. So they're a bulking agent. So the classic endogenous steroid would be testosterone. So if you can give testosterone exogenously, so you can give it, synthetic testosterone, or even like recombinant DNA produced testosterone, you're going to grow bigger muscles, right?
Those were a lot of big words there, Mark.
A lot of big words. You're going to grow muscles with extra testosterone. The problem with testosterone and giving too much testosterone is that it can actually, it can make you more male if you're female. Okay. So females taking this testosterone, they may get a deeper voice. And that actually may continue on even after they stop using testosterone products. Yeah. Now, they may also notice things like their clitoris gets bigger. Is it clitoris or clitoris?
Andrew was supposed to look it up for us.
Let's look up the pronunciation. I'm definitely not Googling that on my work computer. But some other things, severe acne. So no one wants acne, but as with the testosterone, it actually changes the way your body like secretes sweat. So you get more of that. You get more body hair. They can actually have hair loss, kind of like male pattern baldness.
We don't know anything about that.
Right. Well,
Oh, you're going to learn a
Now-
lot
now-
about
now
it. Mike
it
is
comes
working
out.
on an episode about
yeah. Now,
baldness.
why do they always have to drop the bald jokes around me? I'm getting a complex. And because of that extra testosterone, they can actually stop getting periods. They can experience like tendon tears, ligament tears because of all that extra muscle that the testosterone is building. All sorts of problems. Men can also have problems. So because they are kind of, would that be down regulating their own testosterone production? So they're taking the testosterone, synthetically.
So that
their
their
own
body doesn't think they need to make anymore, right?
Right, exactly. Yeah. So their testicles actually start to shrink.
Clitoris.
And then they...
Clitoris.
Clitoris, okay.
Okay.
That's how
Google
Google
So
has
men,
spoken.
men don't have one of those, but they could have their testicles shrink. They can have trouble getting partners pregnant. There's just a lot of bad things that can happen from these testosterone agents. Now, one thing that has happened is there is a large cohort of scientists working behind the scenes on these performance enhancing drugs. So there are newer synthetic hormones that actually take away some of those side effects, especially for the females. So they can block some of those androgenic, some of those male type symptoms and still get the muscle growth, which is concerning still, right? So they still come with a host of side effects, but they're a little bit less detectable. So if the classic, and you guys probably can remember this. I know Andrew could remember this, but in the 80s, do you remember like the East German
I was a baby.
athletes
Yeah.
of the 1980s?
I
Not
remember
really.
the
Not
80s.
really.
Michelle doesn't
I
remember
was
the
not
80s.
I was not there in the 80s.
Okay, never mind. But in the 1980s, East Germany had an incredible Olympic team, and all of their athletes, male and female, had a very distinctive look, and that was because they were using a lot of testosterone and other kind of anabolic steroids. So they had a larger forehead, very broad shoulders. They were kind of impressive, actually, but
Superhumans.
probably not very healthy. So the next one, anything more about steroids? Anything great? Questions?
Do they have any like real use? Like any?
So yes.
I mean,
so that's a great question, actually. So depot testosterone is available as a prescription agent, and it does have a viable use in those with like hypogonadism and other, disease states where you're not producing testosterone. So you've heard a lot about low T, right? And one of the major side effects of having low T is, well, of course, the kind of feel of having not as much testosterone, so decreased libido, but there's also an increased risk of osteoporosis. So that is a treatable condition. But what they would do is your physician, if you think you're experiencing low T, would do a simple lab test. Sometimes they do 2 to kind of see the cyclical pattern of testosterone. And then they would, give you back a little bit. The problem with a lot of these performance enhancing drugs are the dosages are not established, right? So they are giving, pun intended, Olympic amounts of these medications or drugs. And that's where the side effects really, really, really come in. On a personal note, my doctor retired. So I went in to get a new physician. So I walk in, and at the time, I was a young guy, no disease states, no meds. I just wanted to be, healthy. I needed to have a primary care. So I talked to the nurse, and she's like, what meds you taking? None. Do you have any disease states? None. Any surgeries? None. Nothing. She's like, you're just looking for testosterone, aren't you? And I'm like, no, I'm really not. No, I'm not. I just need a new doctor. Mine retired.
yikes.
Well, we don't prescribe that here. I'm like, I don't even want any. But so apparently a lot of people are asking for anabolic steroids. All right. Androstenedione.
Can you buy them on Amazon?
No. So these are not available over the counter or
Okay,
in
good,
any
because
other.
we've discovered some weird things you can get. On
I was going to
Amazon.
say, I'll just double check because
Well,
you
Buy
just
almost
never know.
everything on Amazon.
gosh, who knows? But I hope not.
That was going to be my question: is how do people get their hands on these because
So
they
there
are a
is
controlled
robust-
substance.
There's a
Change
robust
doctors.
black
Black
market. Yeah. Yeah. And there are physicians. So there's a documentary out there called Icarus, and I'm not claiming that it is 100% accurate because I have not vetted it at all. I am claiming it's 100% entertaining. But it talks about, it really does a deep dive into this kind of behind the curtain
It's a culture
goings on.
almost,
It
right?
really is a culture. Yeah. And it's unbelievable the amount of science that's put into it. It's not just, a locker room guy that's like, hey, take one of these. There is a lot of science that goes into this. The next one we're going to talk about is andro. Have you guys ever heard of this? Androstenedione.
I have not.
Okay, so it turns, it's like a precursor for testosterone. So the thought is that you can take this, and then your body will basically turn it into testosterone. There's a lot of smoke and mirrors with this product. It is a banned substance, but you can actually buy it over the counter. But it's still banned by the what is the body? Just a second here.
like the performance enhancing society or something.
Yeah, just a second. The World Anti-Doping Agency is kind of the exhaustive list on this, and it is a banned substance. But interestingly enough, I looked into it, and there's a large incidence of use. So a lot of bodybuilders use this andro substance, but really the studies show that it really doesn't make much difference at all because it's a precursor. So you're still dependent on your body to transform it into testosterone, and it just really doesn't work. But the risks are typical of the testosterone. So you're going to get the acne, you're going to get the down regulation, so the shrinking of the testicles and that kind of stuff. For women, you're going to have the loss of hair, you're going to have body hair growth, things like that. And then there was an interesting study that it actually poses a risk of cardiac disease, so heart attack and stroke. With large amounts of this. So it was a very small study. I'm not going to get way into it, but it was interesting that there really truly are risks associated with this and not very much benefit.
Right.
So this is one of those products that you can actually get if you look around, probably on Amazon. But there are risks associated and there's really not any benefit. So this is definitely one that you want to stay away from. The next one's human growth hormone. Have you heard of growth hormone?
Yes.
Yeah.
Yeah, so I actually read some kind of popular articles on this. There was an article, I want to say it was in Sports Illustrated, but I could be wrong on that, about a weightlifter that was, bench pressing, I don't know, like some obscene number, like 500 pounds, let's say, and was pretty much maxed out. And then he made the decision to use this human growth hormone product, and he had increases of his bench press of like 100 pounds. Over the course of like a few months. So it's unbelievable, the efficacy, but the risks are also very, very, very troubling. And the way it kind of works is it triggers your body right to grow. So it's a major risk for those younger people because when your body is still kind of in that growth phase, so before puberty, it can cause acromegaly, which is that excessive growth of the head, feet, and hands. So it's incredibly dangerous for those kind of younger folks. But then, obviously, if you get a little bit older and use it, it's not good either. So the lips, tongue, and jaw and forehead will increase in size. The fingers and toes widen and become spade-like, which I've never really heard of that. Have you ever heard of that?
I don't know. We were just with my husband's friend in Ohio, and he's got like arthritis in one of his fingers that makes it look like a spade, but
Really?
it's got like super fat up here and super
A
skinny
spade
at the
is a
top.
shovel, right? So I mean,
Yeah,
that would be like
the
flat
opposite.
and skinny.
It's also on cards, like playing cards.
Yeah.
Oh, that's true. But it's a shovel, right? Isn't that the
That's
symbol?
the shape. Yeah.
Yeah, interesting. Not really, but I'm going to say that anyway.
Watch some more Sesame Street.
Yeah, yeah. So, if you actually experience acromegaly, you could life expectancy is death before age of 40. So,
Oh, wow.
it's a terrible disease state and can be precipitated by use of human growth hormone. It can also lead to diabetes, muscle and joint pain, probably because our joints aren't designed to, move that much mass.
Right.
Arthritis, cardiac problems, hypertension, abnormal symptoms of cardiovascular disease, those kinds of things. So human growth hormone is an incredibly dangerous thing. This is still in wide use, but really came into use for bodybuilders, of course. One kind of interesting thing is we're going to kind of transition a little bit from sports. So we talked about anabolic steroids, building mass. We talked about human growth hormone, building mass, right? Well, not every sport is about building mass and lifting weight. You know what I mean? So there are other performance enhancing drugs that are kind of used for different reasons. And one of those is erythropoietin. So we know that as pharmacists, as a medication that we give a lot of times to oncology patients and other patients that need more renal
kidney,
patients.
Kidney disease patients.
Right. That need more. Need more red blood cells.
Right.
So this is a red blood cell stimulant. So before erythropoietin, we actually had the origin of the word doping came back to blood transfusions. So they would actually take their own blood, basically donate blood, store their blood, and then reinfuse their blood right before they raced.
Oh.
So they would have more red blood cells, more blood volume. Well, that is, as you can imagine,
It's a lot more commitment than I have for anything.
Right. And so then it kind of transferred into giving erythropoietin. So it stimulates your bone marrow to make more red blood cells.
And the end result we're looking for here is more oxygen
Capacity. Carrying capacity, right. So more red blood cells, you can move more oxygen around your body. So then you can increase your endurance. So not so much for a weightlifter, not really any gain, but if you're a cyclist.
It's probably any of those
distance
cardio.
runner, yeah. So
Swimming, biking, running.
these erythropoietin and blood transfusions were the favorite of the Tour de France cyclists. So there's horror stories of people who accidentally infused someone else's blood and had transfusion reactions due to it. There was a team that was disqualified in 1996 from the Tour de France. And in their car, they had 300 vials of erythropoietin. So they were just using massive amounts of erythropoietin. I see Andrew.
It's horrible.
Yeah.
I just actually learned something totally different.
Well, that's nice. What did you learn? You just Googling?
So
hopefully not the word that you were Googling earlier.
A spade.
The spade is a type of shovel, but the one that's kind of curved at the bottom and would look like what I would think is a spade is not. It's a shovel. And the one that's flat on the bottom is a spade.
Oh, like a flat-ended shovel is a spade?
Yeah. According to the internet. I have no idea.
I call them all goon spoons. Because I used to have to do a lot of digging in my former life in construction.
Going to ask what your former life was.
In construction. And I was the low man on the totem pole, so I had to run the goon spoon a lot.
Goon.
And then after you got done running the goon spoon, you had to run the idiot stick. That was the rake. You get it nice.
How long ago was this?
Oh, geez. This is a long time ago.
In the 80s.
20 years ago. Not in the 80s. This is the 90s.
20 years ago was the early 2000s.
All right. It was longer than that.
Level set.
Calling me out on math. All right. Let's take a minute here before we get back into it. Let's pause for the Healthy Minute. Brought to you by the winery at Young Farms. Today's Healthy Minute is handle hazardous medications appropriately. Hazardous medications can pose serious health risks if not managed properly. Here are some key tips to ensure safe handling. Know if your medication is hazardous. Read the information provided with the medication or ask your pharmacist if your medication may be hazardous. Follow instructions. Always read and follow the handling and disposal instructions provided by the manufacturer or your pharmacy. Use protective gear. When handling hazardous meds, wear gloves and, if necessary, other protective equipment like masks or goggles to prevent skin contact and inhalation. Store safely. Keep hazardous medications in their original containers, clearly labeled, and store away from food and out of reach of children and pets. Dispose properly. Do not throw away hazardous medications in the trash or flush them down the toilet. Follow local guidelines for safe disposal or return them to a pharmacy take-back program. Clean spills immediately. If a spill occurs, clean it up promptly and use appropriate materials and dispose of the cleaning materials safely. Buy a spill kit before you need it. By following these precautions, we can protect ourselves, our loved ones, and our environment from the potential dangers associated with hazardous medications. Let's prioritize safety in all aspects of medication handling. That was the Healthy Minute, brought to you by the Winery at Young Farms in Mecosta, Michigan. Please visit www.thewineryatyoungfarms for more information. Now, back to the Health Deli.
Boom, chicka, boom, healthy, 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 healthy.
So at this point, that's when somebody says how good a job I did.
That
reading
was
it.
fantastic.
Thank you. Thank you.
I was thinking how perfect it is because all these drugs are hazardous drugs.
I
mean, pretty much all of them, all your
right.
testosterone, estrogen, anything that's going to affect someone else's biological functions
Absolutely.
are considered hazardous drugs.
That's a great point. I'm
That I
putting
don't
a check
think
mark
people knew.
on your performance evaluation for getting this job. That was
Wow.
a great point. No, that is a great point because even passive exposure, especially to anabolic steroids, can have serious health consequences for females. For males too, but for females. So erythropoietin is what we were talking about. And before I move on from that, kind of getting into that universe or that whatever, that kind of black market for all of these products, they're actually working on synthetic oxygen carriers in other countries. And they're not necessarily coming from the legitimate medical community. The push,
Shocking.
I know, the push has came from the black market, from the performance enhancing drug side to create synthetic compounds that will carry oxygen like red blood cells and inject them into human beings to make them more efficient carriers of oxygen. So it's unbelievable. This is not just, we're going to try this, we're going to try that. This is a machine.
Yeah,
that's
I won't be
working in the
signing up for
shadows.
those trials.
No. Do you think they're going to go through IRB?
I just have a feeling Helsinki's going to be upset.
Yeah, probably. Helsinki. So you mentioned that. Isn't that where that's where like the Olympic, is that where that is? Or what's
Isn't that who
That's like the
started
govern.
IRB because of major
the
issues?
Helsinki? Yes. Okay. I was thinking more on the performance. You're right. That's yeah. All right. So stimulants is our next big topic, or our next big chemical that people use. So obviously they can help you exercise longer. They're gonna ward off that feeling of tired or hungry. They can make you more alert, but also more aggressive, which could be good depending on what you're doing. They can make the heart beat faster, so move that blood around quicker and raise your blood pressure. So of course, those can all be problems as well, right? They can actually lower your focus because of that increased anxiety and anger.
Sure.
They can give you trouble sleeping. They can dehydrate you because some of them do have a mild diuretic effect, and the increased sweating and things like that. Right with that, heat stroke, because you're kind of pushing your body too hard. You can become addicted to stimulants, so then you need more and more and more to feel those effects.
I have no idea what you're talking about.
Right, as she sips her coffee. That's a great little segue in, because the most commonly used stimulant as a performance-enhancing drug is caffeine.
Sure.
Now, caffeine is not a banned substance.
Yeah.
Thank goodness.
It makes me wonder, what are the levels?
Do you know what the second most used, also not a banned substance? It's not on the sheet.
I would have assumed it was amphetamines.
No, it's not banned. So it's okay to use. Caffeine is the most, but it's actually a legal substance.
Cigarette?
Nicotine.
Yeah.
Nicotine. Not necessarily cigarettes. It's probably smokeless or
I didn't want to go
vapes.
the route of the drug name because
Yeah.
not
Right.
that smart.
No, you're that smart, Andrew. Don't. Yeah.
I just knew they were a stimulant.
Yeah. So believe it or not, nicotine. You don't associate tobacco use necessarily with elite athletes. So that was surprising to me, but they are definitely used. The other one would be amphetamines, or like pseudoephedrine is a big one too. And that is a banned substance. as well as amphetamines, obviously. And kind of to a lesser extent, street drugs and methamphetamine can also be used, like cocaine, methamphetamines. What else did I want to tell about that?
Makes me wonder if there is a pharmacist at the Olympics. There's a couple,
There
right?
are pharmacists at the Olympics.
Kind of helping to interpret some of these lab tests, and
So I didn't even
because
get
the chemicals can break down and show up very different.
Yeah, and I didn't even want to get into that because that would have been
Could be a
too
whole nother
long.
episode.
It could be a whole nother episode. The amount of lab testing that goes into actually finding these things, because you have to remember, like testosterone, like I have presumably some testosterone in my body.
I hope so.
You know, I
Does it
can't
help with
confirm or
hair
deny.
growth?
But I probably have a lot because I'm losing my hair.
The doctor still won't check for it.
Right. Yeah, he didn't.
No
he
trust
didn't
in
order
you.
a test. No, because I wasn't getting it, so why even get a test?
Why even check?
Yeah. So, but there are ways to find these, even in the presence of endogenous testosterone. So, stimulants are obviously a problem because of the high blood pressure. You can get tremor. You can even have a hallucination, stroke, heart attacks, all of those problems with stimulants. So we don't want to use those. So those kind of end our heavy hitters. And those are the ones that kind of, I think the general public thinks about when they're thinking performance enhancing drugs. And these ones were surprising ones. Now we're getting into those ones that I'm like, that's weird. So I think these are maybe the more interesting. So if you've kind of tuned out a little bit, tune back in, because now we're getting into some kind of interesting ones. Insulin. Why do you think they would abuse insulin? Why would you use insulin for performance?
You took away all the answers on this one.
I just wanted your own take, because to me, originally I'm thinking, and I will give you a hint, it's bodybuilders.
I mean, it moves glucose into the cells and would increase how much glucose goes into the cells, and then the cells have more energy.
Exactly. That's exactly it. So they use fairly small doses of insulin, but nobody really knows. But they're giving themselves small doses of insulin so that their tissues pull up more sugars, more glucose. So there's more available glucose when they're working out. Now, what do you think the risks associated with taking unprescribed insulin would be?
Passing out while I'm lifting
Right,
500
exactly.
pounds over my head.
So if that glucose isn't circulating in your blood and it's being drawn up by your tissues, it doesn't get up to your brain. And then you have
Yeah, I
all
just have a lot
sorts
of
of-
questions on all this
I was
stuff.
gonna
Blood
say,
sugar
I
problems.
remember when I was training talking about how historically insulin was actually used to induce seizures in people. So giving insulin
Really?
to people who didn't have diabetes, who didn't need extra insulin, and would actually cause seizures to try to figure out in people who had an epileptic condition,
Wow.
try to figure out why. So this is like, I only think about the harms of giving insulin to people who don't need it. So
Yeah.
they must be giving themselves some sort of sugar
I'm sure
as
they're-
well.
I'm sure they're
Otherwise-
drinking a lot of, sugary drinks or
Sure.
taking some other kind
Yeah.
of sugar to ward that off, or at least they should be. But that's kind of the incredible lengths that some of these people go
Yeah.
to. I mean, that is just so dangerous.
So dangerous.
To give yourself insulin if you're not prescribed. Beta blockers. So those
Ooh,
of
I
you who
know
are
this
not
one.
pharmacists understand beta blockers decrease your heart rate, and they're used to treat blood pressure or cardiac arrhythmias because they can control the rate of your heartbeat. All right. Why? Why would you use that?
Well, I always have heard it for golf and anything
Really?
else that you need to kind of relax.
I would say I've heard of it for like people who have to do public speaking
Yes.
and are not comfortable. So performance enhancing in terms of giving some sort of a speech to,
Because
it's
it
almost like
blocks-
an anti-anxiety kind of.
Right.
Yeah, Katie and I took some this morning.
Did you?
Just kidding. Totally kidding.
So it doesn't really stop the anxiety, but it stops the effect, right? So you don't necessarily sweat. You don't have that increased heart rate. You don't have the sweaty palms. You don't have the dry mouth necessarily. So these are used, like Michelle said, in sports that require like fine motor skills, like shooting, golf,
What is
archery.
snooker?
Snooker
you've
is
clearly
like
not
pool.
watched Ted Lasso.
I
I've
haven't.
never watched Ted Lasso. But snooker's like pool, right? Billiards.
Pool.
Look, Andrew, look up snooker. I think snooker is a larger table and it's played without pockets, right?
It's
I don't
a
know
cue
exactly,
sport
but
played
it's-
on a rectangular billiards table, covered with a green cloth covered.
Yeah,
Sounds like
it's
pool.
it's like a billiards table, but it's different. Usually the best
I think
billiards
audience
players.
members can look that one up on their own.
Usually the best billiards players started out as snooker players because it's a bigger table. It's a little bit more precision. Yeah.
The bigger table is more precision?
No, it's a more precision kind of game. It's all about using combinations of balls hitting, not necessarily getting them into a pocket.
Oh, okay.
So it's more precise and it's a much bigger table. So if you're a good snooker player, you're going to be a good billiards player. You guys ever watch The Color of Money?
Nope.
Oh, you should. It's a great billiards movie.
Is that an
Lots of
80s movie or?
recommendations and-
Oh, it's an 80s movie. You got that right. Those guys were just pounding the beta blockers, probably. It was Tom Cruise was in it.
Oh, okay.
Oh, there's a Warren Zevon song, and it's a great song. It's a great movie. Have you ever watched it, Andrew?
No.
Oh, you should. Paul Newman, great movie. All right. So obviously the health risk of using beta blockers unprescribed is you can have decreased blood pressure, which can contribute to stroke, not smoke. It can cause some drowsiness, memory loss, and even an asthma attack because of the non-selective beta blockade. We won't get way into that, but it can actually precipitate asthma. Diuretics is our next topic. Water pills. So you take a diuretic, it makes you urinate more, so it decreases your fluid volume. Why would they be taking diuretics?
Decreased fluid, increase your ratio of blood cells. I don't know. Do you have a higher density or ratio of blood cells and
Make it more
oxygen versus
I mean, that's
liquids?
that's an interesting theory.
I have no idea.
Usually 2 reasons though. Usually to beat a test. So they want to flush their system. So they'll use a whole bunch they'll take a whole bunch of fluids and a whole bunch of diuretics.
Okay.
And that's going to flush out their system of whatever they're taking. Or to make weight. So in sports that have certain weight restrictions,
always hear that for
boxing,
wrestling.
weightlifting probably has weight classes, right? I mean,
I would
I'm
think
sure
so.
it has to, right? A 300-pound person could not be in the same class as a 100-pound person. So any of those weight class kind of things, diuretics are used a lot. But it can obviously increase dehydration. It can lead to kidney failure, all sorts of terrible things. One of the interesting things that I saw, my pen just fell apart. One of the interesting things I saw is none of these listed diuretics that are banned, these are supposedly the most common, are ones that I would choose.
Yeah.
Hydrochlorothiazide, in my opinion, is not a great diuretic. But they use it in large
where's my
doses.
torsemide?
Yeah, well, exactly. Well, a loop diuretic is what I think. And then these diuretics can also lead to electrolyte loss, which maybe that's why maybe they understand enough that they can't use a loop.
But you'd be totally messed up if you had high
right. You wouldn't
doses
have enough
of
potassium, so that's actually going to decrease your effect.
your
I don't
muscles
know.
would be
maybe not.
in trouble.
Screaming.
But there's a lot of health risks to these as well. So don't do that. Albuterol. What do you think about albuterol? Why would they use that?
I mean, albuterol does the opposite of what the beta blockers do that we just talked about, right? So those are going to increase your heart rate, I guess, open up your lungs, maybe make it easier for breathing and getting more oxygen into the system.
And that's the commonly held conception, but it's a misconception, which I thought, just as a pharmacist, I'm like, okay, that actually makes sense to me. You take an albuterol, you puff on it a little bit, and they're so widely available, even though they're prescription only. I mean, everybody's got one, right? It seems like. But there was an interesting study, and if you don't have asthma, there's actually no benefit to using an albuterol inhaler.
They get
it doesn't
prescribed
give you-
like candy.
Yeah, but there's no benefit if you don't have asthma in sports. So if I don't have asthma and I used an albuterol inhaler, no benefit at all.
Yeah,
Now,
I would have thought
obviously-
you would.
Yeah, obviously with those with asthma, huge benefit. And the rates of asthma are higher in elite athletes than the general population. I found that, and I didn't fact check that a lot, but it seemed pretty sound on the data that they'd collected. So kind of interesting. It's very
very
counterintuitive.
interesting. Yeah.
Very counterintuitive, but I don't know. So that is not a banned substance, actually, as long as you're using it for a legitimate medical purpose. So Olympic athletes with asthma are allowed to use albuterol. And those who don't have asthma, there's really no benefit anyway. In inhaled albuterol. The difference then is if you take albuterol orally or injectable, believe it or not, it actually has like an anabolic effect.
Well, don't you use it in the hospital? Mm-hmm. Like when we're electrolytes or
not so much.
No?
Not so
No.
much for that anymore. They used to use it in pediatrics. There was I can't think of the disease state, but we would use it as injectable in a certain pediatric disease state. I'd have to look that up. It's not used very much anymore. I don't even know
use
if
it
it's
to
available.
help move potassium, but still inhaled, and it's not very effective because it takes a long time to inhale enough albuterol to really make a difference, which is also probably why we maybe don't see. Well, finish what you were going to say.
No. So there was actually a 2020 study in the British Journal of Sports Medicine that it does have, when given orally or by injection, that it will boost strength and performance because of that mild anabolic effect. So there is a benefit, but you have to take a lot of it, and it has to be oral or injectable. Kind of interesting. GHB. Have we heard of GHB?
We have.
What's the street name, Andrew?
Not in good terms.
What's the street? I'm just trying to get Andrew flagged by IT today, searching all these terms.
Georgia homeboy, goop, grievous bodily harm, and liquid ecstasy.
All right.
It's not ecstasy though, right? Isn't that something different, or is
It
that?
says liquid ecstasy. I don't know.
I don't know either.
What's the feeling it gives you?
I don't know.
Hallucination.
Yeah, it's euphoria and kind of
Is that
hallucinatory.
like ecstasy then?
But if you get enough of
Sounds like ecstasy.
Okay.
yeah, and
Then this is another form of that.
if you get enough of it though, it has like a sedative effect and amnesia. Well, amnesic effect.
Yeah.
I don't even know if that's a word. If I just invented that, please copyright it.
Yeah.
But it's a date rape drug. So why do you think anyone would use GHB as a performance enhancing drug? Any hazard
I
a
got
guess?
nothing.
So supposedly it's an alternative to steroids. And it can actually have some bodybuilding effects. But it's incredibly, incredibly dangerous because the withdrawal from GHB when you stop using it can be deadly.
Yeah.
There was a gentleman, Mike Carcella, and actually died from GHB withdrawal after being hospitalized in 2003. So this is a serious withdrawal reaction when your body becomes used to getting all of this extra GHB. This was also big in Major League Baseball. So there was a fairly large network of GHB use in Major League Baseball quite a few years ago. So, yeah. I think we're getting a little bit short on time, so I got a couple more. Tamoxifen. You guys know?
Estrogen blocker.
What do we use
I
tamoxifen
would say
for?
usually in breast cancer patients.
Breast cancer patients. Yeah. So we usually use it in breast cancer patients because it's a estrogen receptor blocker. So it covers up the estrogen receptor. So in certain types of breast cancer, that estrogen will basically feed it, you can think of. So if we stop that receptor, it can't feed the cancer. So why would you use that for performance? That doesn't make any sense, right?
Estrogen, a lot of it's the opposite of testosterone. So everything that testosterone is doing positively for these performance enhancing.
You get upregulation of estrogen. So if you can block that estrogen, then you can get a little bit extra testosterone basically because the teeter-totter is a little bit more unbalanced. Also though, men will take it because as your body gets more testosterone, it produces more estrogen. So then you get some of those estrogen side effects like breast enlargement and those kinds of things. So if you take the tamoxifen, it kind of knocks that out. Obviously, though, if you're messing with your testosterone and estrogen balance, there's all sorts of terrible things that can happen from that. The last one, very quickly, and this is an interesting one, probenecid. So we think of it as a gout medication.
Yeah.
It changes how your kidneys excrete certain things. And there's not a lot of evidence to support its use at all that it actually works, but people will take probenecid with the idea that they won't excrete some of these agents and they can beat a test. There's not a lot of scientific evidence to support that it actually works. And the reason that they found it was because they were picking up on these tests probenecid in people's urine, and they're like, what the heck is this?
I'm curious, like, how many things are they looking for?
Yeah, I don't know.
Like those tests, how many different chemicals?
Well, I have the actual list of banned substances, which supposedly are they'll test for all of these.
That's what you'd think they'd be testing for even more to start to, because how else are you going to start identifying some of these unless you're like hanging out in locker rooms and getting some of that
right? And it's
top secret knowledge.
22 pages long. I mean, there's so many agents I've never even heard of. So they're just testing for a lot of stuff. All right. Well, Andrew's giving me the hook. So the first job interview, I think, went okay. Way better than Mike. Right. Way better than Mike. So I think it's all about time to hang the sign up. Let's go watch some sports. Let's go catch the tail end of the Olympics. And we'll see you guys next time on the Health Deli.
Sounds good. Thank you, Mark.
Thank you, guys.
I learned a lot.
Thanks for stopping by the Health Deli to sample some of our wares. We're open 24/7 on Facebook and Twitter at The Health Deli, or visit thehealthdeli.com to send us a question or find any of our locations. Please come again. We will be regularly stocking the shelves with fresh content and new wellness specials. As always, we want to give a special thank you to Andrew Tingley and the crew at Ferris State University's Television and Digital Media Production Program. Until next time, so long from the Health Deli, where the topics are tasty, the takes are fresh, and the discussion is free.